to GC Conversations. We have a very special guest today, Dr. Jim Lidstone. Welcome.
Thank you. Nice
We're
to
so
be
glad
here.
to have you here today. Talk to us a little bit about what you do here on Georgia College campus.
Okay, well, I'm a professor in the College of Health Sciences in the Department of, or the School of Health and Human Performance. Been here since 1996. I also direct the Center for Health and Social Issues, and Center for Health and Social Issues is the College of Health Sciences community outreach vehicle, and so we try to do things in the community to help improve the health of the citizens of Central Georgia.
So why is that so important, something that's important for you guys in the school?
Well, we believe strongly in community service. It's one of the three functions of a university faculty member, and for some people it's more important than others, but the university has a mission to be in the community and to help the community, and so we really feel strongly that we want to contribute to that.
Right, and you obviously have some strong ties here to not only Georgia College but to Milledgeville, being in the community since 1996, you said.
Right, yeah, that's correct.
So talk to us then a little bit more about the center. Why is it something that is necessary for not only our community but communities across America, I can imagine?
Yeah, well, we've decided, we have an advisory committee, and we decided when we started the center that we would focus on some different areas. A lot of those are related to chronic diseases, which is probably the number one health problem that we're facing here in the nation. And so our focus areas are cancer, obesity, diabetes, cardiovascular disease, access to health care, and mental health. Those are the areas that we're working on. And
why were those areas something that you deemed or the advisory committee deemed to be important?
Well, because they were, number 1 through 10 on the nation's, health priorities. There's an initiative that the U.S. government has called Healthy People 2020, and so the main focus of Healthy People 2020 is to improve the quality of people's lives and reduce disparities in health care. So we're trying to contribute to that.
So then, going back to the center, how did it actually come about, or when did it come into existence here at Georgia College?
Well, it probably goes back to the early 2000s, and one of our former deans, Dean Pamela Levi, decided that that was something that she wanted to see started. And so I remember having a planning retreat out at Lake Laurel, and all the faculty got together and kind of decided what the Center for Health and Social Issues could be. But everybody's stretched thin for resources, and so there were no real hard resources devoted to the center, and so it kind of languished for a little while. And then Dr. Jimmy Ishii, when he came to be dean, he put a little more emphasis into it, and we actually had some initiatives going, but still no real director or guidance. And so when Dean Gangstead came, and she made the decision that they would devote at least a half-time faculty person to direct the center. And I was fortunate enough to have been chosen for that. So, once you have somebody who's part of whose job is to do that, then obviously it takes on new life.
Right, and a lot of things have come into play, or new initiatives have been taken on since you've become the director. You talked a little bit about the issue of funding, which for so many organizations and groups, funding is a major factor. You've actually gone through the process to apply for several grants to fund some of these programs, right?
Right, and that's where the resources have to come from. And so we initially started in the area of cancer, and we cooperated with an organization over in Macon called Community Health Works. And they helped us get a couple of programs off the ground that trained individuals to work with cancer survivors from the time that they were diagnosed to the time that they, basically were in remission and could be released from the program. And so we have an oncology nurse navigator program for nurses who want to specialize in cancer care, cancer treatment, and then we have a cancer wellness specialist program where our exercise science folks work with cancer patients, like the program that we have at the Wellness Center, the Survive and Thrive program, and they take individuals and incorporate exercise and nutrition into their lives to help with their treatments. So after after we'd done some things in the cancer area, then an opportunity came along from the Robert Wood Johnson Foundation to apply for 4 years of funding for childhood obesity prevention.
It's a great initiative overall when you break down the 5 capstones or the goals that you guys have, but it's also a way for not only Georgia College faculty as yourself to reach out into the community, but students are actually involved in these programs as well. How does that kind of benefit the students that we have here on campus?
Well, I think it benefits them a great deal because, you can stay here in the ivory tower. You might come from suburban Atlanta, and your environment is not very diverse. You might be involved in your community and your church, but when you come here, it's a very diverse community when you get out away from from campus, and so I've had the experience of having some students, actually do things in the community in terms of helping with community gardens and things like that. And, generally what they get back from that experience is far more than what they put into it. So it's really a neat thing to see.
It's great for the students and great for the community. What has been the impact or the feelings that you've gotten from the folks in the community that have been involved in such programs like you talked about?
Well, I'll give you a good example. Every Tuesday at the Harrisburg neighborhood at the Collins P. Lee Center, they have a meeting there around the community garden and walking trail that we're currently installing. And every week, they go around the table and people introduce themselves, whether they've been coming for, 10 meetings in a row or whether they're brand new. And everybody says a little bit about what this garden means to them. And the testimonies that they're giving are really, really heartwarming. And it's amazing how, some boards and some dirt and some cement and some fencing can really galvanize a community around an issue like healthy eating. And so that's been very gratifying to see that happen.
It's nice to see these community members kind of take hold of something that is theirs. I know in a lot of cases, as with the community garden, a lot of these communities may not have the resources or the tools to do things like that for themselves, but for you guys to provide the opportunity to step in and give that to them, it has to be an exhilarating experience to see these communities really embrace something like that.
Yeah, well, they do the work and they have the motivation, but what we do is try to provide some technical assistance and some resources where we can, and to stimulate the project. So.
Well, fantastic. Dr. Lidstone, we'll talk a little bit more about that in just a second, and we'll be right back with GC Conversations.
Up to 40% of businesses never recover after experiencing a major disaster. Make a plan at ready.gov/business.
A full life, measured in seats, starts with the right ones early on. Car crashes are the #1 killer of children 1 through 13. Learn how to prevent deaths and injuries by using the right car seat for your child's age and size.
Really? Buzz, what's up, man? You left some leaves burning out here.
Yeah, I just came in just for a second.
Come on, man. If it's too hot to touch, it's too hot to leave. You could torch the whole neighborhood.
It's a good point there, Smokey.
9 out of 10 wildfires are caused by humans.
Only you can prevent wildfires.
Welcome back to GC Conversations, where our special guest today is Dr. Jim Lidstone. We're talking about the Center for Health and Social Issues, which is an extension of Georgia College. And we're focusing in on some of the topics that you guys hold near and dear and are working to combat in our communities. Let's focus in a little bit on obesity, which is one of the major things. Why is that something that's so important?
Well, obesity is important because it's such a problem in the nation, and because it has dire consequences. It's related to so many other chronic diseases. So obesity is related to some forms of cancer. It also leads to diabetes, which is intricately related to cardiovascular disease, which then results in end-stage renal disease. And so that's why we have so many dialysis clinics that are popping up all over the country. And in Milledgeville, a small community, if you can believe it, we have 10 dialysis clinics.
Wow. That's an amazing statistic there. So one of the initiatives that you guys have launched or are partnering with is Live Healthy Baldwin. Can you tell us a little bit about that program?
Right. Live Healthy Baldwin was started back in 2009, and it was started in response to the call for proposals from the Robert Wood Johnson Foundation to engage in childhood obesity prevention. So we saw that call for proposals, which actually came out in November of 2008, I think, and decided that that was something that we wanted to take a shot at. And it's not an easy process. It probably was about a year and a half process from the time the call for proposals came out until we were actually awarded the funding. But there were 540 communities that applied from across the country, and they selected 40 out of those 540. So altogether, with the pilot communities, there were 9 of those. There are 49 communities that they selected to engage in policy and environmental change around the issues of healthy eating and physical activity.
So that obviously shows that they saw that the need was great here in Baldwin County, right?
Correct. They saw the need was great, but also that we had a strong collaboration or partnership that could address the issues and make a difference.
Well, speaking of addressing some of those issues, can you talk a little bit about some of the things that you guys have worked to put in place or are working towards to make our communities better and to fight not only childhood obesity, but obesity across the board for adults as well?
Sure. Well, we have 8 focus areas that we're working on, 4 on the nutrition side, food access side, and then 4 on the physical activity side. So on the food access side, we have community and school gardens that we're working to facilitate and install, trying to get the farmers markets in town to accept people's federal benefits, the SNAP benefits and the EBT, electronic benefits transfer. We're trying to establish a regional food policy council that would impact the food system as we know it. And so, there are a lot of different aspects of the food system, but most of our food now comes to us from faraway places.
Right.
And so what we're trying to do is create more opportunity for people to be able to buy locally sourced, locally produced foods. And then we have a farm to school program that we're working with the Baldwin County schools on. So on the physical activity side, we're working with the folks in Milledgeville City Council to try to get Milledgeville designated as a bicycle-friendly community. We're working on a network of trails and road bicycle boulevards is what we call them in the community, so that people can share the roads. We're also working on a very kind of a major project, which is a 33-mile rail-to-trail project that would connect the Oconee River Greenway here in Milledgeville with the Ocmulgee Heritage Trail in Macon, where you've spent some time. I know that you know that. And then we also have a Safe Routes to Schools program that we're working with the Baldwin County schools on. So the idea is to try to get more kids walking and biking. It's very hard to walk or bike to school here because of the way our schools are located, but getting more students walking at school, biking before school, after school, weekends, and things like that.
Some great programs in place and some great goals to look forward to. But going back just a second to the nutritional side of things, why is that something that has been targeted as a way to help combat obesity, making access to these community gardens and healthy schools program and things like that?
Mm-hmm. Well, obesity comes down to the old energy balance equation, which is calories in and calories out. And if you're taking in more calories than you're expending, then you're going to gain weight. And so what we try to do is impact that through policy and environmental change. So, we're a nation that, I guess paradoxically, is overfed and undernourished. Now that's not true of all aspects of the community, because we do have some serious food insecurity needs in the community where some children may not see another meal from the time that they leave school on a Friday until they come back on Monday. So there is some hunger issues that are out there, but for the most part we have access to cheap poor nutrition foods, and we consume those in great quantities. So what we're trying to do is kind of change that paradigm to get people thinking about healthier, more nutritious options. And that's where community gardens and school gardens and farmers markets come in.
And those will obviously make a difference as they continue to grow and continue to develop in our community. And now getting back to the healthy living aspect of things, the exercise and bike trails and things like that. Mm-hmm. What has been the response so far that you guys have seen from community members? Are they utilizing these walking and biking trails?
Oh yeah, definitely. I mean, if you go down to the Greenway any day of the week, you're going to see a lot of people utilizing that. And I wasn't here when they first started talking about the Greenway, but I understand that there was some community opposition to it. Why are we going to spend resources on that? Will people ever use it, et cetera, et cetera. But I think it's proven to be a wonderful facility, a great asset to the community. It was, I guess I consider that to be one of the major reasons why we were able to get the Robert Wood Johnson Foundation funding, because when RWJF sees that a community can make something as major as that happen, mm-hmm. then there's hope that other things can happen as well. So it's the old, if you build it, they will come. I guess that's what we're hoping for, and of course it's that's not the magic bullet, but you do have to promote it. And so what we're trying to do is create the opportunities for people to be able to eat healthier foods and to be able to be more physically active, and that means changing the way we've designed our communities. We've gotten away from the idea that you can live close to downtown, you can shop close to downtown, you can walk or bike everywhere. Now most communities have the Strip, which is out of town, and that's where all the the major shopping places take place, with the huge parking lots and restaurants and things like that you have to drive to, because there's no safe way to bike there. And our Bobcat Village is a good example, because I know there's a lot of students that would love to be able to ride a bike from Bobcat Village downtown. It's not very far. It might take 10 minutes to do. They sit and wait for the shuttles a lot longer than that, but they just don't feel safe riding on the roads that are necessary to connect to downtown. So we're trying to make those changes.
Right, trying to make those changes, and people are actually responding, which is definitely a start. This is GC Conversations, and we'll be right back with more from Dr. Jim Lidstone.
Wow, these are really good.
You act surprised. Practice makes perfect.
You don't have to be perfect to be a perfect parent. There are thousands of teens in foster care who don't need perfection. They need you.
Hey, you going out like that?
Yeah, why?
Well, what would the neighbors think?
I see you! Come look at Mr. Feather. Look what I have. Mr. Bird, remember? Bark, bark, bark. We're just playing. We're just
even still.
You don't have to be perfect to be a perfect parent. There are thousands of teens in foster care who don't need perfection. They need you.
When some people struggle with their mortgage payments, they become frozen, petrified. Not knowing what to do, they do nothing. But the people who take action are far more likely to get the most positive outcome. Making home affordable is a free government program. Call now to talk one-on-one with a housing expert about the options that are right for you. Real help, real answers, right now.
Welcome back to GC Conversations, where our special guest today is Dr. Jim Lidstone, and we're talking a little bit about the Center for Health and Social Issues and some of the things that you guys have going on in our community. Now, this is a grant-funded program for the most part, most of the things that you guys do, right?
Yeah, the Childhood Obesity Prevention Project is funded by the Robert Wood Johnson Foundation. The funding started in January of 2010, and it's a 4-year program, and so the funding is scheduled to end, and it will end December 15th of 2013.
Okay, so then where do we stand now? What does the future hold for this and other initiatives you guys have?
Well, what I tell people is it took us a long time to get into this situation, and so it's going to take us a long time to get out of it. So we're committed to doing obesity prevention and, therefore working on the other chronic diseases that are related to obesity for a long time. So we're looking for ways to continue the program, to sustain it through additional funding. So we were fortunate back in June that the Healthcare Georgia Foundation was interested in doing obesity prevention work, particularly childhood obesity. And so what they did, they had done some prior investigation through the Georgia Family Connections organization about communities that were currently doing obesity prevention work. And so I participated in probably about a 45-minute phone interview with a member of Georgia Family Connections, and I didn't have any idea what it was about, but then what turned out that they were looking for communities to invite to be involved, and so in June we were fortunate to be one of 10 communities or organizations that were invited by the Healthcare Georgia Foundation to apply for an additional 3 years of funding. And out of those 10 communities, they were going to fund 4, so those are pretty good odds, a lot better than the 40 out of the 540 that we dealt with before. And so they selected us as a finalist. They came here and did a site visit back on August the 12th. And then their board is meeting sometime towards the middle of this month, very soon. And we should hear shortly after that whether we're one of the communities that was selected for funding.
How important is funding in continuing all the initiatives that you guys have in place?
Well, it all comes down to money,
right,
and
right.
Funding is everything. It pays for the salaries of the people that continue to be involved. It provides the resources to stimulate some of the projects that the Community Garden Association or the Bike Club or any organization that one of our partner organizations is doing to further the work. So yeah, it's critical. So we're keeping our fingers crossed.
Definitely, and we'll keep our fingers crossed with it as well. But in the meantime, you guys have a lot of events and activities coming up that community members can get involved in.
Absolutely. So, there's always things that are going on. And again, the Center for Health and Social Issues is the lead agency on this project, but we have probably 20 partner organizations that are out there that are actually doing the work. And so in terms of community gardens, we have a new project that we're currently in the works, and that is a community garden that would be a joint Community Garden Association and Georgia College project on the site of Evergreen Baptist Church out North Jefferson on Ivy Weaver Road. And so there's an interest meeting that's going to take place on September the 22nd from 4 to 5 out at Evergreen Baptist Church. So anybody that might be interested in contributing to that project, potentially having a plot there at the garden for them and their families, or students who are interested in doing that, faculty members, staff, welcome to come out there on September the 22nd. Another community garden interest meeting is every Tuesday at 11 o'clock at the Collins P. Lee Center That's in the Harrisburg neighborhood, 237 Harrisburg Road Southwest. And so if you're interested in seeing the impact that a community garden has made on a community, feel free to come out and drop in on that. It's just really heartwarming to hear the testimonies from those folks that on how that community garden has kind of galvanized that community. In terms of bicycle activities, on October the 4th, which is First Friday at 6:30, anybody who's interested, who has a bike, need to have a helmet. Meet us at Oconee Outfitters, and we're going to do what's called a Batty ride.
Okay, what's that?
Okay, Batty is spelled B-A-T-T-Y, and it stands for Bicycles Are Traffic to Y'all.
Very good. Very
and
good.
so what we do is we, in a safe and obeying the rules of the road kind of a way, we ride around the community and just interact with the traffic and the drivers, and we kind of take in all of the First Friday events that are going on. And then the Bike Club is sponsoring the second annual Deep Roots charity ride on October the 19th. And that's going to start at Central State Hospital. There's a lot of things going on in the community that day. The Deep Roots Festival, which is a huge thing here in Milledgeville, brings thousands of people in. I believe we have Parents Weekend. Georgia Military College has their alumni days that day, alumni weekend, and so there's going to be a lot of things going on, and the Deep Roots ride is just one of those things. And there are going to be very different options for people to ride. There's a 5-mile family-friendly ride, and then all the way up to a 100-mile century ride for those real hardcore folks that want to get out there.
Wow, that's amazing. So a lot of opportunities for people to get involved, and a lot of great things that you guys are working on, as well as the new garden that we're trying to develop and things like that. For people in the community that may have an interest in some of the programs, or may have some ideas for further development as far as community gardens go, walking trails and things like that, is there a way for them to touch base with the center or with you guys to kind of talk through some of these community issues?
Absolutely. So my door is always open, or people can call me or email me. My phone number is 478-445-2133 on campus, and I assume we can get that up on the screen. Email jim.lidstone@gcsu.edu, and or contact the Milledgeville Community Garden Association, the Bicycling Club of Milledgeville. Those folks were more than willing to get people involved in their activities.
I guess what we've really found through this is that the center is not only here for health and social issues, as the name says, but it's really for the community to have better access and better availability to fight or to assess the social issues that may be in place.
Absolutely.
Okay, Dr. Lidstone, thank you so much for joining us today. And that's it for this edition of GC Conversations. Join us again next time.